Hi, today we gonna talk about COPD, chronic obstructive pulmonary disease. COPD is a state characterized by the presence of airway obstruction due to chronic bronchitis and emphysema, and usually is a progressive disease and not fully reversible. First, we gonna talk about chronic bronchitis, which is a chronic disease of bronchial tree, characterized by cough and expectoration daily, for 3 successive months, for at least 2 successive years. And, causes are infection, or irritation, as smoking and air pollution. It could be simple chronic bronchitis, that is hypertrophy of mucus gland, leading to cough with whitish mucoid expectoration. Or it could be chronic obstructive bronchitis, that is organic narrowing and progressive decline in air flow, due to mucus gland hypertrophy and infiltration of bronchial wall with inflammatory cells and scarring. Second, we gonna talk about emphysema. That is permanent dilatation and destruction of distal to terminal bronchioles, or forming one large alveoli after the destruction of small alveoli, leading to reduce the surface of gas exchange. Causes could be emphysema associated with chronic bronchitis, which is the commonest, or could be alpha-1 antitrypsin deficiency that protect against alveolar wall destruction. Or could be compensatory emphysema, as in bronchiectasis and lobectomy. Or could be senile or atrophic emphysema that is usually asymptomatic. The emphysema is classified according to site of damage, to centri-acinar emphysema, that is concentrated around respiratory bronchioles and mostly associated with smoking, and to pan-acinar emphysema, that affect the whole acinus or alveoli, mostly associated with alpha-1 antitrypsin deficiency, and to irregular emphysema, that affects the lung parenchyma. COPD show combination of these two diseases, with predominance of one certain feature over the other. So there are 2 types of COPD. Think puffer type, emphysema is dominant, so there is hypoxemia with normal CO2 level, so there is severe dyspnea without cyanosis. Blue bloater type, chronic bronchitis is dominant, so there is hypoxemia with hypercapnia, so there is cyanosis without dyspnea. Symptoms are cough, which initially mucoid productive, then purulent sputum with exacerbation, mostly worse in winter or after infection, and dyspnea progressive over years, and persistent wheezes. Complications are recurrent chest infection, bronchiectasis, pneumothorax, respiratory failure. Complications of cough is hernia and insomnia and ribs fraction. On X-ray show normal, or low flat diaphragm, and narrow elongated cardiac shadow. And improves on bronchodilator test, but less than 15% on pulmonary function test, but improves with bronchial asthma more than 15%. Thanks for listening. That was all today. I hope you learned something. Thanks again and subscribe for more.